Hello, my name is Nicholas Cohen. I'm a family doctor and I'm here to share with you 10 tips for women age 65 and older. Tip number 1. Do some kind of physical activity for at least 30 minutes every day. Physical activity has many benefits. The benefits include living longer, reducing your risk of falls, reducing risk of depression, of cognitive decline, and obesity. There are many different ways to get 30 minutes of exercise a day, including walking, stationary bicycle, Tai Chi, yoga, just to name a few. Tip number 2, maintain a healthy diet. A healthy diet consists of a limited amount of red meat, as little as possible, protein that's low in saturated fat, especially fish, chicken without the skin, peanut butter, and other forms of nuts and beans, whole grains in preference of refined grains, and limiting amounts of extra sugar such as from regular soda or desserts. And finally, at least 5 servings of fruits and vegetables. Tip number 3 is take a daily vitamin supplement. After age 65, women tend to have it's very common to have a vitamin B12 deficiency, and it's recommended that you consume a vitamin B12 10 to 15 micrograms per day. I recommend that you take this in the form of a multivitamin that includes vitamin B12, at least 10 to 15 micrograms a day. Also, calcium and vitamin D decrease as you get older, and a vitamin supplement helps reduce the risk of fractures from osteoporosis. So take a daily supplement that contains calcium 1200 milligrams and vitamin D 800 international units, and that's each day. Tip number 4, cancer screenings. There are several ways to prevent the most common forms of cancer, and it's recommended that you follow these recommendations. Mammogram. A mammogram to detect breast cancer is recommended at least every 2 years up until age 75. The frequency with which you get this test and the age to stop should be discussed with your doctor. The next screening test is pap smears. If you're age 65 or older and you've had 3 normal pap smears recently, and you don't have any new risk factors for cervical disease, such as new sexual partners, it's recommended that you stop being screened with the pap smear. But this is a decision that would be good to have with your doctor. The final cancer screening test that's recommended is a colonoscopy to detect colon and rectal cancer. This exam is recommended every 10 years, starting at age 50, and usually at age 85 is a sufficient number of tests, and you can stop being screened at age 85. Tip number 5, vaccines. There are some great vaccines that can prevent common infections. It's recommended that you receive the influenza vaccine yearly, starting at age 50. The pneumococcal vaccine is recommended once at age 65. The tetanus vaccine is recommended as a booster every 10 years. And the zoster vaccine is recommended at age 60. This can prevent shingles. Tip number 6 is a DEXA scan. All women starting at age 65 should have a bone scan. It's an x-ray of the bone that is used to calculate whether or not you have osteoporosis. This scan is recommended at age 65, though in certain women who have higher risk for osteoporosis, it should be done at age 60. Once you've had this test done, it can help you and your doctor decide whether you need treatment or prevention with medication for osteoporosis. Tip number 7 is to stop smoking if you smoke and to limit your intake of alcohol. Quitting smoking is the most important thing you can do for your health, and quitting smoking decreases your risk of heart disease, of many types of cancer, and of COPD. Alcohol should be limited to no more than 1 drink per day for women and no more than 2 drinks per day for men. Tip number 8. Discuss with your doctor a daily low-dose aspirin. Daily low-dose aspirins can reduce the risk of stroke in women starting at age 55 and older. However, there are side effects of aspirin, and they should not be given to people with certain risk factors. So discuss with your doctor whether or not a daily aspirin low-dose pill would be recommended for you. Tip number 9 is to get an annual checkup. Seeing your doctor each year is an important way for monitoring your blood pressure, checking your hearing and your sight, screening you for depression, doing a physical exam, and also reviewing any medications that you have and answering any questions and concerns you may have about your health. Tip number 10 is to believe in yourself. There's wonderful opportunities and great ways to stay healthy when you're a woman age 65 and older. I hope these tips have been helpful for you, and thank you very much for listening. Have a great day.